Hey there, future nurses. What's up? This is Dr. Knight, your DNP nurse educator and mentor. Today, I come before you because I want to talk about something real. Most of you have signed up for nursing or you chose the nursing profession because you want to save lives and you want to secure the bag. Am I right? After 30 years of being in this nursing game, working in med surg, critical care, leadership, and now clinical nurse instructor and educator, I want to give you 10 steps or 10 gems that's going to help you navigate from a student nurse to a confident registered nurse, helping you get to the bag early. If you want to level up your clinical skills and get to the bag early, I want you to smash the like button and let's get into it right now. Okay, let's start with step one. Step one is come prepared and stay organized. Listen closely. Nurses that are prepared, organized, separate themselves early from nurses that are going to be struggling in the future. I'm talking about showing up with your stethoscope, pen lights, pocket notebooks, and multiple pens. Show up with the tools that you need. Why? Because organization and preparedness will show the organization and staff that you are serious about the profession. And when you're serious about the profession, they will be willing to invest time in developing you, helping you get to the bag early. Step number two, master your time. This one is very important. Time management is essential in nursing. You have to be able to provide care for multiple patients. So I need you to start focusing on time management right now during your clinicals. Okay? Here's what I used to do. Get in early, get prepared, get everything gathered before I enter a patient's room. Make sure I'm ready to do my assessments, give my medications, document, and educate. Boom, boom, boom. Efficiency, on to the next patient. I know this sounds complicated, but trust me, you'll be able to do it. Start now in clinicals, okay? Why does it matter? Because nurses who manage their time well become charge nurses, they become supervisors, they become bosses. They become that six-figure nurse early. So let's start mastering our clinical time right now so you can get to that bag. Step number three, embrace the learning mindset. Mindset shift is so important in nursing. You got to have the right mindset. I'm talking about knowing that students who there's a difference between students that are thriving and students that are just surviving. And the difference is it's the mindset shift. They come in with the right behaviors and the right attitudes that's going to help them excel above other nurses and nursing students, okay? Every single mistake, I don't know, I feel lost, I'm unsure of myself. It's not a failure. I want you to realize that that is tuition. You are paying to learn. So learn everything now while you're in clinicals, okay? I had a student one time that was so afraid to start IVs, afraid to go into a patient room. By the third or fourth week, this student was doing everything she's supposed to do and just went on to become a great nurse. I want you also to know students that ask questions, students that volunteer for procedures, students that accept challenges as opportunities. These are the students that's going to set themselves apart from the rest. These are the students that's going to get offered positions and get hired quickly. They're going to get to the bag faster. Step number 4 is build professional relationships. Now, I know you don't think about this as students, but I want you to know relationship building is a priority. starting now as nursing students. And I'm telling you to start now. And what I mean by that is nursing is a team sport. So network will determine your net worth. Don't ever forget this. Network, mean networking with that staff, will help you position yourself to get better positions and higher salaries. So, when you're introducing yourself, be professional when you're talking to staff, whether it be a doctors, nurses, other healthcare team members. Always start off being professional and maintain it throughout your whole clinical rotation. Building your future and your career starts during clinicals. Why? Because during this time, you will be connecting to people that's going to help you in the future. You will find that some of those staff nurses, some of those supervisors will be the ones present during your interviewing process. So make sure you establish relationships with them right now. Quite often, you will be able to go to them to get references. They will help you navigate higher salaries. So make sure you are always professional at all time, okay? Here's the inside secret. Being genuinely helpful, offering to restock supplies, offering to do anything you can to help those nurses out because y'all know they are very busy. Show that you can help or you want to help in any area, okay? Show that you're not there just to check off things. Show that you want to be a part of the team. Okay, this is going to help you in the future. The nurses, and respect your ethic work will help you get the job in the future. So just remember, relationship building is essential, and please start during your clinical rotation. Step number 5: prioritize patient safety. Patient safety is number 1, okay? It's a non-negotiable. Patient safety is first and foremost, okay? And I know some of you as students, you work in other areas, you might show up a little bit overconfident, but I want you to be a little bit humble, always ask questions, ask for demonstrations, and always make sure that you are working alongside another registered nurse or your instructor, okay? Here's the business side of it. Hospitals look to hire nurses that are safe, nurses that reduce their liability, and of course, nurses that can improve patient outcomes. So patient safety is a priority. All right. It's going to lead to you getting hired, and it's going to make sure that you secure the bag. I mean, safe nurses get hired. Final point here is that I know you don't have a license, but you getting your license is a ticket to you getting the bag. So start off in clinicals doing the right thing so that you can progress on to getting your license, learning and growing in the profession, okay? You need that license to get the bag. Let's go. Step number 6, strong communication skills. Now, communication. You're going to hear this throughout clinicals, throughout school, throughout your whole nursing career. Communication is essential for patient safety and essential for saving patient lives. Okay? So, nurses that are able to communicate are going to be able to separate themselves from the pack immediately. So I want you guys to focus on learning SBAR, situation, background, assessment, and recommendations. If you haven't heard of it, look it up, start preparing it now, start using it immediately during your clinical rotations. When you're communicating with your with your instructors, I want you to make sure you're using SBAR. Master this and you will sound like a seasoned professional nurse, and it's going to separate you from the rest. Okay? Strong communicators. These are the people that move on to become charge nurses, supervisors, directors, nursing educators. They're going to get to that 6-figure salary quicker. They're going to advance quicker, and that's who you want to be. Let's get you to that bag early. Practice SBAR throughout your entire clinicals. So by the time you graduate, you have got this down pat. Step number 7 is mastering documentation skills. Now, we all know if you didn't document it, you did not do it. Now, I know we're not using paper a lot anymore, so a lot of your documentation is going to be in the electronic medical record. I want you guys to, during clinicals, to observe seasoned nurses documenting. Matter of fact, ask if you can scroll to see their notes. This way you will know how they are communicating in the electronic medical record. Learn the facility system right away. And each time you go into a different clinical environment, there might be a different system, but as long as you learn the format, you should be able to be successful. Ask questions about documentation standards and continue to watch nurses chart. Nurses who document well, they get noticed by management. They're the ones who get pulled into specialty units, quality committees, and leadership roles. Why? Because documentation shows attention to detail and professional responsibility. Quality nurses who document well become charge nurses. These are the nurses that's going to advance quickly, get to that six-figure bag. So master documentation and get promoted faster. Let's move on to step number 8, take initiative. Now, take initiative is very important because I know a lot of students, they are unsure of themselves and they don't know what to do. But when you're trying to learn and develop your clinical skills, you need to be more engaged and know your weaknesses and your strengths and know what you need to learn. And you need to be able to communicate that to your instructor. So, for example, if you see a procedure taking place and you're unfamiliar with it, you need to ask, can you observe it so that you can learn more? That's taking the initiative, okay? Taking initiative doesn't mean overstepping your scope of practice. It means you're just being proactive in learning. So if you know you want to start IVs, you need to let your instructor know that so that she puts you in that situation where you can learn. If you're weak and given SBAR, let your instructor know so that you can practice it. And you can even practice this with your colleagues. You guys can practice on each other. Okay, but you need to take the initiative for your learning process. Don't just assume that you're going to go into clinicals and everyone is going to be there directing and showing you everything. You need to identify what your weaknesses and your strengths are and build on it. Take the initiative. If you see nurses that are overwhelmed and busy, you can step up by saying, how can I help you? And that's going to separate you from the other nurses. What can I do for you? Okay, you can offer to help patients go to the bathroom. You can offer to set them up, get them water. You can help to educate. You can help do a lot of things in the clinical area. Just make sure you ask your instructor and make sure you are functioning within your scope of practice as a student. Initiative taking students become the nurses that managers fight to hire, because these are the people that are always going to step up. They're going to be the solution to problems. They're not going to be like sitting back. They want to offer solutions when they see or identify a problem. So be that nurse so that you're able to separate yourself and you can get to that bag, that six-figure salary quicker. Number 9, let's practice safe care and stress management. Now, ladies and gentlemen, this is so important. If you're going to thrive in nursing, you need to start early and taking care of yourself. And by that, I mean that you need to make sure you're getting enough sleep. You need to make sure you're staying hydrated, exercising, taking care of yourself, okay? Nursing is a very demanding profession. A school is challenging. The clinical environment can be stressful. So you don't want to burn out early. So if you start with self-care early during your clinical rotation and continue it, you will be able to separate yourself because you are going to show that you are able to withstand the demands and take care of yourself and also be able to take care of others. So it is essential. Okay. Just remember that nurses who practice good self-care have longer careers. Now, I know you can't see yourself working 10, 20, 30 years, but I'm here to tell you that the time goes by fast. So you will be in nursing for a long time. Now, you might be in different areas of nursing, but if you love the profession like I do, you will remain in it. I'm still in it after 30 years. Okay. The bag isn't just getting your first nursing job. Remember that. It's making sure that you are building something sustainable, all right, so that you can continue to work. Professional development, all right? Invest in yourself. It's critical so that you're able to thrive in nursing. Lastly, step number 10, reflect and continuous improvement. And by reflection, I mean that you should be able to reflect on what you have learned and what you need to learn, all right? Uh, what transforms good students into exceptional nurses is the ability to reflect and then seek opportunities to improve. Now, I know a lot of my students, when they're giving feedback, they get deflated. They feel like they're being attacked. But I want you to be able to take constructive criticism, recognize that it's a weakness and it's something that you need to improve on. All right, because none of us come out perfect. We have to learn as we grow. I still continue to learn every day. It's a learning, growing profession. Okay, lifelong learning, and it's part of professional development. So I'm going to recommend that during your clinicals that you journal from the first day you start clinicals to the end. Get a journal book and just start writing down how you started, how you're doing in the middle, and how far you have come. That will be an essential tip for you, okay? So professional development is very important. And also, when you're in the clinical environment, I want you to always seek feedback from your instructors. I always talk to my nursing students. I motivate them a lot and I let them know that they're there to learn, and I don't want to turn them away from the profession, but I want them to feel comfortable. I try to create that safe environment where they're comfortable enough to ask me questions and learn at the same time. Because I remember when I was a student, it was tough. And I wish I had someone that was as supportive as I tried to be. Okay. Um, Lastly, nurses who reflect and improve become the nurses who advance quickly, okay? They get chosen for specialty training, leadership development, and high responsibility roles that come with significantly higher salaries. So I know you guys want to get to that bag. So these are the 10 steps that's going to help you get to that bag earlier. So listen, future nurses, these 10 steps aren't just survival clinical tips. They're going to help you thrive. So what I want you to do, if you start to implement any of these steps, I want you to comment on how you're doing and how you're progressing in your clinical advancement, okay? So, with that, I just want you to remember that you're not just a student, you're a future RN. So, start acting as if you are an RN now. You know, how they say you need to act what you want to be. So, when you show up in clinical, show up professional and ready to learn. Okay. I'm Dr. Knight, and I'll see you on the next video offering you more real talk about clinical nursing. So happy clinicals.